Shark bites, pros, cons, advantages, disadvantages. Going to give you 5 of each. Also, I'm going to go through some of the things that you might want to know also, including what you should know beforehand, the piercing procedure, healing the piercing, jewelry, living with the piercing, and also what happens if you don't want them anymore and you decide to take them out. Coming up next on Pros and Cons by a Piercer, Season 2, Episode number 96. For those who are new to the channel, welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the video. Some of you find it helpful and useful, but you might not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio, located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So we're talking about a oral piercing grouping. This one is 2 piercings on each side of the lower lip, called a shark bite, or shark bites. I never know if it should be shark bites piercing or shark bite piercings. It's one of those things, kind of messes with me. Lip piercings have a long history of in tribal people in Africa, in the Americans, in the Pacific. Most of the piercings, though, we do today, including the bites, were developed during the 80s and 90s. We used to just do these, and we'd call them like, you want 2 labres here, and you want 2 labres there, or 2 lips there, or 2 that. But they've got a bunch of names now called bites. Let's get into the pros. The advantages, the things that make you go, ooh, I want that. Starting with number 1, long history of healing. These are piercings that have healed for a long, we've had a lot of people heal these over the years. They're not a very difficult heal, and you probably have very few issues. Number 2, symmetry. Everybody wants symmetry. This is one of those piercings that it draws in the whole face, giving that look that everybody enjoys of having 1 on each side. In this case, it's double. It's 2 on each side. Number 3, like most oral piercings, pretty quick healing. Anywhere from 2 to 3 months is a pretty good average with these as far as healing. Number 4, can be done in stages. If you want to do maybe a set of snake bites and then add on to them, that's possible. Maybe you want to do spider bites on one side and then do spider bites on the other side and then have shark bites. So it's possible to do them in stages. Number 5, draws attention to the face, into the mouth, into the lips. Enhances the area. Makes it beautiful, or more beautiful than it is already. With the pros out of the way, let's move on to the cons. The disadvantage, the things you say, no, get that thing away from me. Starting with number 1, risk of damage. With oral piercings, there's always a risk of enamel erosion, gum erosion, softening of bones and structure in your mouth. In this case, because there's 4 of them, you have 4 times the risk. Number 2, placement can limit the type of jewelry you can wear in this. Depending on how high they're done on the lip or how close to the lip they're done, you may not be able to wear circular jewelry in it. If they are done high, you can do circular jewelry in it. Otherwise, you're stuck with post jewelry. Now, that's not necessarily a negative thing. You have a lot of choices from just simple balls all the way up to very detailed, very ornate, different types of ends. Number 3, like with oral piercings, the swelling. The swelling usually lasts anywhere from 2 to 5 days. It can make eating difficult. It can make talking difficult, and it's uncomfortable. It's kind of like you got punched in the face. Number 4, scarring. Oral piercings tend to be one of those, especially in the lower lip. They do produce pretty pronounced scars, easy to see. They can look open long after they're abandoned. It's one of those piercings where it's on your face. It's very visible. People will notice it. And the last one, number 5, can close pretty rapidly. Oral piercings, regardless of how long you've had them, they can close in a matter of a couple hours in some cases. Some people, they can keep them out for days, but that ain't everybody. And just kind of a little bit of a bonus one is this will make eating large sandwiches and etc. Very difficult at first. You are on a very limited diet during the healing process, especially if you do all 4 in one sitting. With the pros and the cons out of the way, let's move on to what you should know before getting it done. Or prepping or preparing for it. First off, go out and have a great, fantastic meal before you get this done, because your diet is going to be very limited in the near future. So go get that out of your system. Go get some great, whatever food, Thai food, Italian food, whatever your comfort food is, so you can kind of bone up on that, because you're not going to be able to touch any of that stuff for a while. Check with work or school. If you are in a situation where you're involved with something, either through employment or through after-school activities or sports, and there's a dress code, you need to talk to those people in charge to make sure that you're going to be able to have this piercing or these piercings. These are not going to be piercings you can hide. These are going to be very visible piercings. People are going to notice them, and I mean notice them. This grouping of piercings can affect employment even after the piercings have been abandoned. The scar tissue, as I mentioned earlier in the cons, can last a very long time, and it can be very noticeable and look like you still have them even though you don't have jewelry in them. So take that into account. Your piercer should be experienced, skilled, done a lot of these, and verified, and willing to give you a pre-piercing consultation that covers things like how to take care of it, cross-contamination prevention, risks that are involved, and anything else that may involve healing the piercing and having the piercings. They should also check out your anatomy to make sure that you are able to get this piercing correctly and not have issues. There will be a diet change. Usually soft foods are going to be your best bet. It's a best, and I'll go into that maybe a little bit later. It's best to stock up on those things beforehand so you have them on hand so you don't have to go running around shopping with this, 4 fresh piercings. Does your piercer give you verbal and written instructions on how to take care of it? It's important, regardless of how easy it is to find this information on the internet, that you have detailed instruction on how to take care of the piercing properly, or piercings. It's going to make your life a lot easier. Next thing is you should plan on downsizing. They're going to pierce with something that's too long to allow for inflammation and swelling. You're going to want to downsize to a shorter post, roughly about 4 to 8 weeks into the process. Sooner if you start catching on teeth or it's causing issues. Now let's move on to the piercing experience itself. First thing that's going to happen is you're going to have a consultation with your piercer. They're going to cover things like how to take care of it, cross-contamination prevention, diet, risks, etc. Also, they're going to take a look at your anatomy and judge whether or not you're a good candidate for these piercings. Next thing that's going to happen is you're going to have a setup and waiver. Next thing, they're going to have you fill out a waiver or release form of some sort, which is going to ask information about your medical conditions, whether or not you're an adult, all kinds of fun stuff. Fill it out and be honest. If you do have some of those medical conditions or on medication or what have you that may affect how the piercing is going to turn out, it's best to talk to your piercer beforehand. They may be able to adjust what they're doing to make things okay, or they may suggest that you delay until you've talked to a medical professional. Next, your piercer is going to set up all his equipment. He's also going and then disinfect the area, usually with a surgical scrub of some sort, and then mark it. When you're looking at markings, look at them up close and at arm's length. People that are kind of weird or schizophrenic see you at this closeness. Normal people see you at arm length and further. It does make a difference. They look different from far away. Understand what the goal here is to make them appear to look like they're even and they match your face. We generally don't measure things out. What we do is align it with the tips of your nose to kind of give it kind of more so it fits into your face. If you're unhappy with how it looks, voice your opinion. It's easy to move marks, but it's harder to redo piercings. Next up, we'll put you in a reclined position, and then we will take a set of Pennington forceps, clamp off the tissue, inject a needle in and through, remove the forceps, push the needle out with a guide pin, threaded guide pin, thread the jewelry on, or if we're using threadless, put that on there, and then push it from the inside, then put the top on, front, and then you're done. Now repeat 3 more times. There might be a little bit of slight bleeding immediately afterwards, usually not a lot. Throbbing and aching is pretty normal. That usually lasts a few minutes. Other than that, it's going to be tender to the touch. You might notice some immediate swelling. With some people, these just swell up almost immediately. Not everybody, though. Now, As far as how many to do in one sitting or what have you, personally, if you came in and asked me about getting these done, I would generally suggest doing snake bites or spider bites. I'm sorry. I would generally suggest doing spider bites, meaning 2 on each side. Do one side, heal it out, and then do the other side. The reason being is that gives you another side of the mouth to do things like eating and chewing and drinking and etc. You don't have all of this all at once. It's going to be easier to deal with in sleeping and etc. Than it would be if we did them all in one setting. Pain-wise, most people say pain level, these are between a 2 and a 4. Understand that kind of increases each additional piercing you do in a sitting. It's kind of like the first time you do it, the first piercing, your body's like, hey, stop that. And then next one's like, hey, you really need to stop this. And by the third and fourth, it's screaming and yelling at you and calling you things that make you cry. Now let's talk about healing. Average healing time, like I said on this, is anywhere from 8 to 12 weeks. Sometimes as far as 4 months, but that's pretty rare. During which time you want to clean twice daily using a sterile saline spray. We sell Neomed's Piercing Aftercare. It's what I generally suggest. However, that might not be available wherever you are in the world. Other options are out there. The main thing you want to look for is it needs to be in a hard metal can under pressure. It should say sterile on the can. When you turn it over and look at ingredients, the only things that should be listed there would be a purified water of some type and sodium chloride. In other words, water and salt. Nothing else. The other thing I suggest doing is into your shower, pour your hair and everything out of the way and just let the water flow over the piercing area for about 30 seconds to 60 seconds. What we're doing with these two things is removing the discharge that's going to harden and crust on the jewelry, the crusties. We're removing them for a couple different reasons. First off is comfort, because when they get pulled through the piercing, they don't feel good. And also, they can agitate. That discharge can agitate it, which can lead to issues. And it's just more comfortable, and also it produces an area where your body can produce more discharge. For the inside, I'm going to suggest that you rinse a couple times a day with a alcohol-free antiseptic mouthwash. My personal favorite is Biotine, 30 seconds twice daily. Some people find warm saltwater rinses with sea salt and warm water help kind of take the edge off everything and make it feel good. Now let's talk about swelling. You're going to want to reduce your intake of tobacco, alcohol, cannabis, hot and spicy foods, things that are extremely warm in temperature, vaping, or anything that may agitate your mouth. If it hurts to ingest something, don't do it, because it's just going to lead to more swelling. Soft foods are best. Things like yogurt, baby food, applesauce, smoothies. Cold items are fantastic. Gently sucking in ice chips, popsicles, all that stuff is great while you're going through the swelling phase because it feels good and it helps reduce the swelling. Stay hydrated. Very important. Drink lots of liquids, especially throughout the night. Also, sleeping with your head elevated above your heart will reduce the amount of swelling. Usually, you'll see the worst of the swelling first thing in the morning, and that's a combination of the blood pooling in the area and also you becoming dehydrated. So, if you can drink some liquids throughout the night and also sleep with your head elevated, less swelling in the morning. Also, limit the amount of movement in the area. Try not to talk as much. Don't eat things that involve opening your lips a lot and chewing. The less movement you have in the area, the less swelling you're going to see. If you've never had issues using over-the-counter anti-inflammatories such as ibuprofen, that's not an issue. When in doubt, always consult a physician. Also, there's been some studies that have shown that use of CBG oils can help. You don't pour it directly on that. It's to ingest it. It can help with inflammation. That's one of those things where I'm still doing a little bit of research on. One of the things you're going to learn is you have to kind of change your diet, how you eat, and everything else to avoid contact with the jewelry and the piercings. It's extremely difficult when you have 4 piercings healing at one time. Be cautious. Take your time. It's frustrating at first. Eventually, all of this is going to become second nature, and when you downsize, eating becomes a lot easier. You must practice cross-contamination prevention. This could involve washing your hands before you handle it, no oral contact, deep mouth kissing, or sexual contact for a minimum of 8 weeks or until the piercing is healed. You are more susceptible to STDs during oral sex, so if you switch partners, Use a latex barrier like you're supposed to. Keep your environment clean. That means clothing, bedding, towels, anything that may come in contact with the area needs to be cleaned on a regular basis. No swimming. I don't care how clean the water is. If you're getting in a body of water that's large enough to submerge your whole body in and move around, it's going to be filled with microorganisms. You have an open wound on your body. So basically, they can work their way in there, and then you have an infection. Keep pets away from it. Don't let them sleep in the bed with you, especially the smaller animals. They'll sleep up right by your face and mess with you while you're sleeping. Keep your utensils clean, and do not share food items and utensils with other people. Icky. Do not use whitening products. They can cause issues with a fresh piercing. Kind of mentioned this beforehand. Avoid movement. Also avoid playing with them. Don't be pushing them out with your tongue constantly or catching them on your teeth and chewing on them. That is all going to prolong healing period and prolong swelling. First 3 to 5 days, there might be a little bit of slight bleeding off and on. Most people don't even notice it. Of course, the swelling can last up to about 5 to 7 days, depending on the person. So if you do everything wrong, longer, you should downsize in roughly about 4 to 8 weeks. The shorter, basically, as I tell people, it's like the sweet spot for most people is right around 5 to 6 weeks. If it gets to a point where there's no more swelling and you're just catching the thing all the time, come in and let us downsize, because there's no reason to have that longer jewelry there any longer. Should leave the jewelry in at all times. This piercing can close very rapidly. It's not something you can take out to go to band practice. Now let's talk about jewelry. Leave the jewelry in at all times, as I just said. I'm going to say it again. Did you hear me? Don't take the jewelry out. Even after the piercing is healed, removing the jewelry for long periods of time will cause the piercing to collapse and close. So if you like it, leave something in it. With threaded jewelry, the ends should be checked on a weekly basis. Pick a day of the week, and that is ball checking day. Put it in your calendar. Confuse anybody that sees it. I really suggest avoiding things that have sharp edges and points. They tend to not do well. I know people like the spikes and all that stuff and the cones. You'll like them until you catch them on towels day after day after day after day after day. Usually simplistic jewelry is your best bet for long-term wear. Now, it's okay if you want to go out and you're having a special occasion, put something fancy and blingy or whatever. But for day-to-day wear, it's usually best to kind of stick with something a little bit simplistic and small. Jewelry, if the jewelry is really loose-fitting, it needs to be downsized to a correct size. Additional movement, contact with teeth and gums is just going to cause problems. Usually these piercings will nest a little bit where it pushes into that soft tissue a little bit. That's perfectly normal and okay because it pulls it away from the teeth even more. But if you have something that's sliding back and forth all the time, you do need to get some correctly sized jewelry. If you have a medical situation where you have to remove the jewelry or what have you, you can wear glass jewelry temporarily in these piercings to keep them open. Now let's talk about living with a piercing. Check the ends on a regular basis. Like I said, weekly is your best option. Avoid stress and contact with the jewelry. Do not do things like hang things from them or pull on them. It's not good. Said this before and I'll say it again. Leave the jewelry in at all times. Only take it out to replace. During oral sex, practice safe sex the way you're supposed to, which means latex barriers for 6 months until you've both been cleared. It's a good idea to brush jewelry to clean off plaque or use an anti-plaque rinse. Sometimes if the plaque gets on that post, it can agitate a healed piercing and cause problems. When in doubt, see your piercer, see if they can take it out and clean it for you to remove everything. That and it has a smell if you don't clean them on a regular basis or brush them at least. Now, finally, let's talk about abandoning the piercing. If the piercing is healthy, there's no signs of infection, whether it's healing or it's already healed, removing the jewelry shouldn't cause a problem. It will close up if it's during the healing process pretty quickly. If it's already healed, the tissue will kind of collapse on the inside and then slowly fill out over time. You will be left with some scarring, but beyond that, there's nothing additionally that you really need to do. If the piercing looks unhealthy, there's signs of infection or other problem, consult your doctor or your piercer before removing the jewelry. We do not want to create a situation where you remove the jewelry, the piercing holes close, and it traps infected tissue and fluids inside that piercing, and then you're off to a medical professional to have them lanced and drained. It's usually best to get them checked out before you remove them if you're in doubt. Sebum. I don't know why people squeeze old piercings, but we like to squeeze everything on our body, I guess, especially if it produces something. It's not common to see this white kind of cream cheese consistency stuff. If you put it up to your face, it smells awful. That is sebum. It is a waxy oil that your body produces that it lubricates hair follicles. It also helps to make you watertight. It's completely normal and natural. It tends to collect in crevices and around scar tissue. Don't squeeze the piercing. There's no reason to do that, and there's no reason to freak out. There's nothing wrong. What's your experience with shark bites? If you have them, leave a comment. Let everybody else know what that experience was like. Till next time, here's hoping your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, would love to see you for your piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in that next video.